We are here at Dr. Nemeth's annual spring seminar with a very special guest. Dr. Thomas Rams, professor at Temple University, is here. He will be speaking later. And the people are just starting to fill in. Here's Dr. Nemeth's booth right here. Welcome to those of you who are just joining. Got quite a big turnout this year. We got about 500 people registered. And I'm going to show you a few of the fabulous vendors that we have here today. Got a whole nice spread of food right here. Looks like the doctors have already picked that over. We're just getting ready to get started here. One of my favorite staff members, Val, rocking our brand new jackets that we had made. Say hello, Val. You've been doing a great job. This is the first time that we've been at the Troy Marriott. We've got Care Credit here, helping patients finance their procedures if they should need it. And over here we have some of my close friends. Hello. They're doing a drawing with a referral. I accidentally spilled her coffee earlier, so I'm trying to pretend like that didn't happen.
Your car's just too slick, right?
I'm coming back. Team Rehab Physical Therapy. Sorry. Looks like they got some giveaways over here. People are just starting to find their seats. We're getting very close to Dr. Nemeth's presentation.
People bring it to the show. Just so you know, we're here. We usually send an email ahead of time to doctors. They can bring it on site. Okay. All right. Bring some of stuff on the show. Where do you do the meltdown? Right? You do the refinery right here? How's everybody?
I'll come back. All right. Let's go check out some of these other fabulous vendors. We got Doran Mayhew. Looks like they are financial advisors, CPA and advisors. We've got Expertech. It's a dental lab. Hello. I am live on Dr. Nemeth's YouTube channel right now, and I was wondering if you might be able to tell me a little bit about what you guys got going on over here. Oh, come on. What do you guys do? Okay, so you help with dental financing. Got it. That's awesome. Awesome. Is Dr. Nemeth one of your clients? Okay. Yeah. I'll see if I can talk to him. I'll see if I can talk to him about it. I'll put in a good word. Yeah. So good to see you. Got some dental models over here. This looks like full arch models. Wow, look at these cases. Beautiful. All these are implants. Wow, love it. Moving right along. This looks like they're doing toothbrushes, electric toothbrushes. Hello. Let's see what else we got over here. Hello, sir. How you doing? I'm doing well. I'm live streaming on Dr. Nemeth's YouTube channel. Yeah. Do you want to give me a little spiel about who you guys are, what you do?
Yeah, Sofu. Sofu dental products. We make a great line of braces, great line of composite chairs. We have the
that what this is right here?
Yep.
That's cool.
It helps simplifies practices by leveling the playing field, so to speak, for anybody that takes photos.
Oh, that's awesome. So how does this work?
So instead of having to understand how lighting and photography really works, all our camera's design is to choose a mode. It's a mode-based design.
Ah.
So, and camera efficiency says it's got to be lightweight, easy to use. So this is a 1 pound camera based off of the modes. So it's one-handed. So whoever's taking photos,
Yeah, it looks light.
Yeah, has the other hand free to help direct the patient, help with retraction, hold a mirror. And if you're really good and get efficient with it, it's not a hang-up where all of a sudden where we just got busy and couldn't take photos. It takes
I
a minute
see.
to take a series of photos.
I see. That's awesome.
Yeah.
Yeah, thanks for showing me.
Thanks for stopping.
Appreciate it. Hello. Hi. Doing the live stream again. I remember you from the fall seminar. Good to see you again. Yeah. So you want to tell me a little bit about what you guys do?
We do have a line of different separators, as well as our Flex Series instruments.
Oh, wow.
We have our WAMP for crown and bridge removal instrument. Various implant products.
You guys do it
what's
all.
New to Golden Dent is our Wago Trips. It's our new sectional matrix system that does have disposable matrix rings.
Awesome.
We have our implant locator for submerged implants and carry a full regenerative line of bone grafting products.
Wow. Looks like some great stuff. Remind me your name one more time. Jenny, Skylar. Nice to meet you. Good to see you again. Thanks. And moving right along, the man, the myth, the legend. He's here, having conversation. Wave hello. We're live on YouTube right now. Yeah.
This is Mr. Stello Life.
Dr. Nemeth.
Yeah.
He's an amazing clinician.
Fantastic.
And a fantastic person.
He really is.
Gennady was helping me with my back.
Really?
Yes.
There's an exercise.
I gotta put my foot up here and stretch out like that. And stretch my hamstring. And he said, this is gonna save my back.
Does it work? You feel it?
It's the only thing that actually helps me.
That's fantastic. I'm so glad to hear that.
And my back inevitably bothers me, so I'm hoping that with your help I can make it through.
Fantastic. It was a pleasure meeting you. Thanks, Dr. Nemeth. We'll see you up there.
So it's going to be where?
This is live on YouTube right now, and it'll be posted afterwards, so you'll be able to see it. Hello. How you doing? Good. I am live on Dr. Nemeth's YouTube channel right now, and if you guys would like an opportunity to tell me a little bit about what you do, now's the time.
Well, we have a laboratory, a large laboratory in my area. We provide all laboratory services. And recently, Amar Katranji to our clear aligners for orthodontics.
Great. That's fantastic. You got some of your models right in here?
Yeah, plenty of models. You can see there. These are the aligners. We do all the printing of the models for crown and bridge.
That's awesome.
Ramping up now for digital dentures. And
Very nice.
and anything for a laboratory to produce for a doctor. You've got it. Right?
That's fantastic. I'm Skylar. Nice to meet you. Thanks so much, you guys. Appreciate it. Yeah.
Practice. I was
My man over here. Good to see you. How you been? Good to see you too. So as you probably remember in the fall, I'm live on his YouTube channel right now. If you want to tell me a little bit about your services, I'm sure they'd be interested. Awesome. That's amazing.
And then we have our community heroes, our community X program, community hero program as well. And that applies to
all medical, government, first responders, educators, and military.
That's fantastic. Great. That's fantastic. Thanks so much for sharing. Good to see you again. I'll be looping back around. Yeah. Oh, wow. Check this out. Lots of toothbrushes, soft bristle, hard bristle, anything that you could need. These look like they're all manual toothbrushes. This is a one electric one right here, all by Gum, which make great products. They're the ones that do the Soft Pick Advanced, which I'm sure you've seen Dr. Nemeth talk about in his videos before. So this is Gum by Sunstar. We got more vendors over here. Everyone seems to be mid-combo. It looks like the seminar is just about to get started, so without further ado, I'm gonna start heading back towards the main room. It looks like they're clearing out lunch over here. Oh, check this out. How you guys doing?
Good, how are you?
Good. I'm live on Dr. Nemeth's YouTube channel right now, and I'm just basically going through all the vendors, showing what you guys have to offer. If you guys want to give a little spiel, you're welcome to do so. Yeah. Just tell me a little bit about what you do.
Sure. So we're a super biomed, which is utilize their Japanese software that brings places for us. So we use the environment's been around for many years, and it's probably the most used implant company and system in the state of Michigan.
That's fantastic.
So we're both utilized by the University of Detroit, Michigan. Customer service. That's why we're here to help support this event.
Great.
So that's about it.
Thank you so much. I appreciate it. Nice to meet you. Yeah, thanks. I know it is. It keeps everything nice and still. Yeah. Take care. All right. It's just about to get started. That man with the metronome is coming through, telling everyone to return to their seats. And let's head into the main room. A little bit. Oh, these two.
Incredibly bad. I mean, it was just a mess. Before I begin, I want to announce that our annual fall seminar will be Thursday, October 24th at the Curtin Manor in Livonia. This year, we will feature
I'm going to move a little bit closer to the speaker so that you can hear what's going on.
presentations. First is Randy Alvarez. I'm pretty sure none of you have heard him before. He's a wonderful speaker, and he's a dental consultant and host of the Wellness Hour TV show. We'll start the morning and share marketing, and he will start the morning and share marketing and advertising secrets of the most successful, highest earning practices.
Thanks, Ronnie OG.
Watching, listening to, and paying attention to. He's very, very, very sharp when it comes to building practices. Then the Maddow brothers will present all their new Insider's Guide to Dental Practice Success. So this is an all-new program. We've had them before. They're always great. This is an all-new program, and I know you will enjoy it. Plans to join us then Thursday, October 24th. Watch for our mailings with more details in the coming months. It's going to be at Burton Manor, and I think it's going to be special with two great speakers. Please take a minute to fill out the orange, if I have it here, which I do. Take a minute to fill out the orange contact information card if you haven't already. Give us that info so we can send you updates on what's happening. We can make sure that you are registered here for your CE credits. So fill out the orange contact information card if you haven't already. It's important that we have your email address to contact you with information about upcoming events and to send digital x-rays. And later, be sure to fill out the blue seminar survey, which
And
is this thing right here.
here's our last presenter, Dr. Thomas Rams and Dr. Millman. They're just catching up a little bit before he's got to go on stage. Say hello. Wave hello, Dr. Millman. Thank you.
Just make sure and leave the orange and the blue contact and evaluation clothes. It's important. I also want to thank our exhibitors for participating in this event this evening. If you haven't already,
You guys want to say hello?
look at their products and services during the
Okay,
break.
ready?
Our first
This is our booth.
speaker is my
Beautiful
colleague,
setup over
Amar,
here.
and his
We have Doreen and Don who work at the office over here. Thanks, you guys.
Peri-Implant disease. Now, Amar, in my opinion, is the best implant specialist, bone builder
It's introducing Dr. Katranji.
in the United States. Really. I mean, he is amazing. I have 2 implants in my mouth. I've never had a bit of problem with them. He did them. He's great. First of all, he's very handsome, which I don't care for that. He's also very tall. He's very athletic. None of those things do I like. But he is a great, great practitioner. He's a great periodontist. He can do everything. But he particularly does great jobs with implants, treating peri-implantitis, building bone. He's absolutely great at it. So he handles that part of the practice because I just don't like doing that stuff. So with no further ado, or further ado, here's Amar.
I always say this thing is true. I mean, really, he's a legend. So I'm kind of like in the presence of a legend every day. So I'm the lucky one. I learned quite a bit from him, and you're going to see some amazing cases as he's going to show later. So we all should be pretty thankful that we get to learn from Dr. Nemeth a little bit today. So today I get the task to talk a little bit about peri-implant disease, peri-implantitis. It is something that we see quite a bit in the office. As we do more and more implants, as more and more implants are being placed, utilized, we see more and more complications associated with them. We all know that there's differences between teeth and implants, and the more we study these things, the more we realize they're foreign objects in the mouth, and the body treats it differently than a tooth. We know there's a lot of different ways the body reacts to a tooth, and we also know that there are different pathogens that sit on the tooth. Well, we used to think they were the same pathogens on the implant. We're learning more and more that that's not the case. In health and in disease, the bacteria that we're fighting on an implant is different than the bacteria we're fighting on a tooth. So we're learning more as we place more and as we study these things a little bit more. So there's a clear difference when we're looking between the two. The disease progression, they tend to imitate each other and they look very similar.
Exactly.
We have different terms for them, but they're more or less the same. A lot of times we might say mucositis or
You wanna wave
peri-mucositis.
hello?
That's similar to gingivitis.
You wanna
And then
wave hello?
peri-implantitis is very similar to periodontitis.
To the
But
streamers.
again, the pathogens might not be the same. And you'll see the prevalence of disease with peri-implantitis. Many times you'll see the prevalence quoted anywhere between 5 and 50%. And a lot of that has to do with how we're defining peri-implantitis. Depending on whose definition we're using, we'll see an incidence that's a little bit different. In some cases, we look at 2 millimeters, sometimes 5 and above. So when you see these things, I would say there's definitely a prevalence. 50% prevalence of peri-implantitis seems a little bit high to me. It also depends on what implant systems and what implants we're discussing. Many times we're looking at older studies, and those studies might show older designed implants. And those tend to fill a little bit more, especially with the knowledge that we have today with surface treatments and design of implants themselves. So probably, if we were to look at new age implants, stuff that we're using today, it's probably around 8 to 10% as far as peri-implantitis, which is still pretty significant if we consider 2 million implants or more are being placed each year. I only place half of those. In health, we typically see something.
I'll see if the interference is better back here.
Typically, we see some pink tissue. When you probe these things, you shouldn't see a lot of bleeding. Mucositis, again, mimics what gingivitis looks like. You'll see a little bit of plaque. Usually there's some compliance issues. We'll see plaque around the implants. We'll see a little bit of a response, bleeding. That's what we'll typically see with mucositis. And then, of course, in the bone, when the bone starts to become involved in this, we'll start to see bone loss around these things as well. So typically, we'll see more separation and bone loss radiographically. So I always tell people the earlier we deal with peri-implantitis, the more likely we are to save these. You'll see a lot of cases today. I'll show you the cases where I'm saving the implants, where we're reconstituting the bone around the implants. And then you'll see some where I just can't do anything about it, and we're actually replacing those implants with larger grafts first, and then finally replacement of those implants. The diagnostic markers are very similar to periodontal disease. So, when you're thinking about peri-implantitis, you also want to think about, just what you traditionally have learned about periodontal disease. What kind of creates the disease process is typically what we're going to see with implants. And then risk indicators. The number one thing, honestly, when we're talking about these things are smokers, heavy smokers. Anybody of active or more, I typically don't want to do surgeries on. I typically ask them to quit smoking, especially if it's a larger procedure involving grafts. They just don't. They typically don't turn out the way that we'd like them to turn out. So a lot of the decisions that we make during surgical placement of the implants will kind of give us an idea of what the longevity or long-term prognosis of those implants are. Many times when we're placing implants, especially there's a huge need to do immediate implants. I know a lot of people are taking courses and learning, and there's definitely a benefit to placing implants at the time of extraction, but just do your due diligence as far as what that socket looks like when you're actually placing an implant. So many times, you take out a tooth, you place an implant, but if you were to flap that, you might actually see a very thin buccal plate. Placing an implant in a situation like this is more difficult long-term for that patient to maintain, for the soft tissue to maintain, and then over a long period of time, if any incident happens around those implants, you'll start to lose a lot of bone around that implant pretty quickly. So thin bone, especially at the time of extraction, is something that you should be aware of. Soft tissue grafting and bone grafting is typically what you want to do to create a better situation. So if you look on the left side, very, very thin ridge. If you place an implant there, the diagnosis or the prognosis of that implant is going to be a lot different than when we graft around that site. And again, when you have a site that's very, very thin, grafting is something that's pretty predictable nowadays. We can definitely regenerate and create bone for those implants for the longevity of that implant. If you were to compare the two sites, any implant going in the left side is probably not going to be a long-term lifetime implant, whereas the ones on the right are the same. And that's the same patient over about 6 to 8 months of treatment. So improper planning leads to compromised results. And we'll see a lot of these cases. And these cases, again, are the ones where maybe the decision to place the implant came too quick. If we waited 3 months or 4 months for healing and proper treatment planning, we probably are going to get a much different result than what we're seeing today. So when you're looking at those cases, even when we're talking with patients, I like to do immediate implants, but not in all cases. A lot of times I have to slow down and tell the patients, this is what we're going to try to do. We're going to try to make this last a long time. We want it to look good for you. So 10, 15, 20 years from now, you don't have infection, you don't have a situation like this. So talking about implants and peri-implantitis, we a lot of times start talking about how do I probe around an implant, or should I be probing around an implant? My personal opinion is a little different than what you might hear from other people, but you should know that there's no evidence against probing implants. So probe implants, and you should feel very comfortable probing around implants. My concern sometimes is when you work so hard for the soft tissue, and many times the implants are a lot narrower than the roots, it's very difficult to get your probe to give you an accurate measurement. So to go around the whole implant, individual markings on an implant, one, you might not be getting a very good accurate response or a good accurate reading, and then two, you might actually be disturbing the soft tissue, which is something that we're working very, very hard to create. But you need a baseline. You always need a baseline. The recommended use of force on a probe or on an implant is 0.25 newtons. I personally can't do that with my hands. I don't know what that is, so it's very difficult for me to tell you, this is how much force. Just use your common knowledge. And then we know there's a difference between where the probe ends in a tooth and where it ends in an implant. With implants, it goes straight to bone or a little bit above the bone. With teeth, depending on health or disease, we're typically seeing it either in the apical portion of the junctional epithelium or the coronal portion of the connective tissue. So we get a different reading, we get a different idea of what's going on with teeth in comparison to with implants. So again, my personal opinion, get a baseline. You don't have to go all the way around the tooth. Just make sure that you get some baseline that you can compare to in the future, and then mark down where you took that baseline. Either is it facial, is it lingual? A lot of times with implants, getting it mesial and distal is very difficult. So to get a really good accurate response or good reading is very difficult. And then only probe when you see a reason to probe. Again, this is my personal opinion. When you see some soft tissue, inflammation, or if you see something radiographically, that's a good time. So if I looked at this case, this is definitely a case that we And many times when we look at the x-ray, if we see something along this line where we're seeing vertical bone loss, again, this is when we're probing. And a lot of times we see cement. And so cement is something that many times we say peri-implantitis instead of peri-implantitis. The idea really is that we have to be extra careful when we're cementing our implant crowns. And we all kind of know this, and this is probably one of the main reasons why we have peri-implantitis today. Another thing is placement and seating of your abutments. This is another reason why we get a lot of peri-implantitis. This becomes very difficult for the patient to clean. It becomes loose. It starts to impact the soft tissue in the collar. And use of systemic antibiotics is important, especially when you start to see suppuration. So whenever we're called to bring down the inflammation of an implant that's failing, we typically put them on a regimen that's strong, that's going to be effective prior to doing any sort of resective surgery. Lasers are something that we use quite often. There's definitely a lot of literature about lasers. You can see a response in lasers, especially in certain cases. I will use lasers when I'm being more conservative or in certain situations where I don't want to maybe open a flap. I want to be a little bit more careful with the soft tissue. So you see a lot of regeneration in some of these cases after the use of lasers. Hopefully we'll learn a little bit more about that later. So how do I manage these cases? Many times it's explantation. If you see an implant that's moving, it's failing. I've heard, I've had some conversations with some doctors and they say, well, if you leave it in there long enough, sometimes it will regenerate. So this is just explantation. Again, when we see cement, when we open this up, this is a foreign body reaction as well, now to the cement. Now the cement has something to do with this failure. Obviously there's a lot of compliance issues as well, but we definitely have to make sure that this is removed. In cases like this, we can regenerate in some areas. In some areas, we're removing threads instead. So we're looking at these cases, again, over and over again. We'll see a lot of cement. So here's a case where a patient comes in. A lot of work was done to make this crown look really good. The soft tissue is very nice. I mean, if you were to look at this without that little dehiscence, without that little infection there, you'd probably say, which one is the implant? When you probe, you start to see a little bit of infection. Of course, you can probe into there. And what do we find? We find cement. So all that time, all that effort into getting good surgery, good bone grafting, good soft tissue, and then a little bit of cement created a big problem. So in cases like this, we have to detoxify. There's many different things you can use. You can either use a laser, a little bit of bone grafting, soft tissue grafting, and then suturing. Over time, we get a good response. We are able to regenerate and maintain aesthetics, but of course, there's always a little bit of a drawback from those procedures. A case like this, again, we're probing, there's quite a bit of inflammation, and the idea here is really to get rid of the infective properties, which is the cement here, clean it up. Here we're grafting again, remembering this time.
I want to say thank you guys so much for watching. Dr. Nemeth only wanted me to show part of the seminar this time around, but if you are a dental practitioner or a hygienist and you're interested in earning some continuing education credits, Dr. Nemeth does fantastic seminars. They're in different locations every time. This time it happens to be in the beautiful location of the Detroit Marriott Hotel in Troy. And I want to thank you again for watching, and stay tuned. We got another upload coming this week, and have a great day. Thank you.